Welcome to this third part in the four-part series on varicose vein and also the other similar conditions of piles and varicose. In this third part, we actually focus on the comorbidities or the associated conditions that are normally found with those suffering from varicose vein and piles and varicose, and also the challenges that are faced when simultaneously treating these conditions. So with this, we also look at how the similarities of these conditions bring out challenges in a very different way when we look at the different variety of treatments for each of these conditions. So the first question we start is on what are the common comorbidities associated with the varicose vein patients.
See, one of the most important thing is obesity and this metabolic syndrome as such. This obesity, diabetes, hypertension, dyslipidemia, that is high cholesterol and triglyceride. And as you know, all this was there, the heart disease also can be there. So that is the major combination we are seeing. Next is arthritis. After a stage, because most of these patients will be having obesity, abdominal obesity will be there. So the osteoarthritis of the knee will be very common in this patient. And next is that is usually what I had seen in my patient is with this varicose vein, especially after surgery, they get rheumatoid arthritis sort of damage in the foot also. That is even the toes will be either shifting towards medially or laterally. When it is taken as laterally, or that both ways, it can be going like this or going like this. That is actually usually happens with the rheumatoid arthritis, but this sort of varicose vein patients will not be having any rheumatoid arthritis problems in the hands, or there is not deviation or the joint fixity much in the hands, but they will be having in the foot. And they'll be very common to have calluses at the sole of the foot also. And that will, if I make it many way, it will be very difficult for the movements and especially walking, because they'll be having a varicose vein problem with the leg because of the venous pooling. The pain leg will be aching and paining, and the arthritis of the knee, osteoarthritis usually, that will be hurting, and the problem with the ankle and the foot, because of the alignment is in the bad shape, they'll be having pain. And along with that, actually, this alignment problem will be making the callus formation and pain, pricking pain when they are walking. So you see many patients who is having all these problems actually. Diabetes to obesity to diabetes to varicose vein and this sort problems and everything. That is very common if the patient is for a long-standing disease, especially if they are coming in their 50s or 60s, almost all these problems will be there.
So when you are looking at these comorbidities and all that associated, generally we hear that we are treating these different conditions individually results in drug interaction, and generally too many drugs have to be administered to the patient. So in such situations, how is the approach?
See, for many of the patients, if those who are coming for the varicose vein alone, because they'll be coming for the treatment because of the severe edema and ulceration or the bleeding, they'll be coming. And they'll not be able to walk, or that will be their problem. They will not be even bothered about their diabetes or hypertension because they are taking tablet for that and they're not worried about that. But when you have discomfort only, you will be worried about that. So that is one type of patients who are coming for many. Usually they might have tried the sclerotherapy or the laser surgery or the stripping or different mode of treatment once or twice in their already they might have. And now there may be an old non-healing ulcer or the edematous, eczematous lower limb. That is one type of patients. And another type, they'll be having diabetes. Their major concern will be diabetes, and the piles and varicose vein is a minor concern. Or there are patients who have asked for a bypass surgery or an angiogram after doing this stress test. So, but for them, that before we start the clinically supported lifestyle correction, we will ask for what are the problems, any other problems. Then they may say that they have some varicose vein also. And some people, they won't show in that stage also. Only after 2 or 3 weeks, when they're comfortable with the other things, their problem is solved, then only they start thinking about the pain on the leg or the deviation or even the sole callus formation and pain. They will think only the major issues are over. So, for all these patients, if it is in the modern medicine, as you know, the diabetes tablets are there, insulin is there, hypertension is there, give the medication. And we have seen so many medicines. They may be having 10 or 12 or even 20 or 30 tablets a day. I had seen patients like that. But if you are willing for a lifestyle correction in a proper way, that is, you don't know what is the corrected lifestyle, that is the reason for all these problems. You are obese or diabetes or hypertension is because we don't know. This is actually all these diseases are lifestyle diseases. You don't know how to manage your lifestyle or how to understand your body. For doing this lifestyle correction, you should have a very clear idea about the body situation also. So understand about the body and correct it in the proper way. All these diseases, the diabetes, if it's a type 2 diabetes, usually the type 2 diabetes is the most common. The type 2 diabetes, we can stop the medicine in the first day itself, and can, because if you stop, everyone will be worried how to stop. I am taking 4 times insulin and taking tablets for diabetes. How can you stop? What will happen? See, if you're stopping the diabetes medication, morning dose of insulin, and you're checking after 2 hours, you can see the blood sugar is coming down. Then why should you worry? And even with if you're following the things, because if you're not eating carbohydrate, how can your blood sugar increase? So simply you can correct it within 24 hours, not even 24 hours, 12 hours itself. You can see your blood sugar is under control. If provided, even when you are in the morning, your blood sugar is 250 also. If your diet is proper, you can bring down it to below 140 within the 12 hours, even itself. So that's simple. If you are going and doing the lifestyle correction in the proper way, it is that simple. And BP, hypertension patients, actually, every day we follow up. If you are taking 3-4 medication for the BP, within a month, all the medications, actually, not even if the patient is following and everything correctly and giving feedback correctly, most of the patients within 2 weeks itself, BP medicines can be reduced. It depends on the patient parameters also and how they are following the things correct, whether it is doing the correctly. And it is that simple. Actually, even for the varicose vein ulcer, your skin lesions, itching, edema, it's all will be reduced within a week itself. The 8th day, when the next visit, we see that discomforts are reduced. And everything is proportional to how much the patient is able to follow and make it practical.
Actually, when you're talking about this varicose veins, how is it related to this peripheral artery disease? Because basically, peripheral artery disease, and sometimes it can come along with this varicose veins. So then it's heard that treatment is more difficult.
Yes, definitely. If the peripheral artery disease, even there is no varicose vein itself, is a very difficult situation because there is no blood flow is affected. And nowadays, putting stent in the blood vessel, it is not actually giving much benefits because you can put stent only in big vessels, not in the small vessels. You may be able to put a stent on the calf muscles, but already the blood vessels are not the big vessels. Small vessels also already affected. Then what is the point of putting a stent there? And immediately there may be some benefit because you are pushing away that fat which is creating. But actually, when you are putting this metal spring-loaded sort of thing into this thing, and just pressing away that fat which is blocking. So after some time, immediately there may be some little blood flow is increased, but after some time that will get blocked because that is a metal, that is foreign body, and there can be the immunological reaction, and there may be clot or something like that, and it can even create problem. But that is the thing. And along with that, if it is the veins also is varicose vein also is there, so the problem will be more severe. But I had seen patients in my experience, when we start, usually if this is a peripheral artery disease is there, we'll do a Doppler study to see how much is calcification. Usually the calcified vessels with the arthromas, that is fat deposit inside the blood vessel, which is calcified also, can be there. But if you are doing a lifestyle correction in the proper manner, we follow it by every 3 months, this repeat Doppler studies and see how much changes. And there are patients who can even the calcification is removed. It is applicable for the heart also, but the heart you cannot directly check into. For those patients, CIMT, that is the carotid artery, the blood which is flowing into the, supplying the brain, can be assessed very clearly at the neck level. So if there is calcified plaques also there, and if the patient can follow the things correctly, and you can check it, and the plaque, the thickness of the plaque will be reduced, and even the calcification can be reduced, and even the patients, if you following for a sufficient long time, it is completely gone. That calcification is completely recovered. So that shows that our body's ability to repair. So every second, your millions of cells is replaced with the new cells. So it is said that after 7 years, the whole body will be changed. Actually, in 90 days, 90% of the cell is replaced, because most of the cells are blood cells actually, and they are small. So 90% the blood cells, in 90 days, many times the blood will be replaced. So if you can give 90 days the optimal nutrition and optimal exercise to improve the circulation, your 90% of the cell will be replaced, and you can be comfortable. That is what my experience also. With the clinically supported lifestyle correction, if the patient is following everything correctly, within 90 days, the problems will be over. Only thing, if they are very obese and all, they may be having some more reduction in the weight and all. And major problems will be. But if you want a complete renovation of your body, is according to the science also. Actually, we got the number of days of each lifespan of these cells and all. The WBC is only within 7 days, 4 to 7 days only. The RBC is having 3 to 4 months, or the platelets 2 weeks, and different, even the liver cells 1.5 years. So many different timing is there. So accordingly, these cells can be replaced, or those who are permanent, like the nerve cells, they cannot be replaced. But now latest studies show that they are also regenerating capacities. Their new nerve cells can also produced, or at least there is repair, possibility of the repair of the organelles. The cell is not simply one entity. There are so many small entities or organelles are there, just like organs in our body. There are organelles in the cells that can be repaired also. So the repair, the body's ability of repair, if you are used, you can even correct the arteries and the heart blood vessel blocks, even the coronary artery block, or the varicose veins. You can, if you start at the early stage, it will be easier. But even if I had seen patients with varicose ulcer, non-healing ulcer 1 year, they're also getting out of it. That color change and the problems cannot be as good. Even the darkening of the skin, and is within 2 or 3 months the non-healing ulcer can be cleared, but it depends on the extent also. The patient should be reasonably healthy and should be able to follow things correctly, then only you can expect result. But those many patients who are having even the varicose ulcers and the thick eczematous skin and even this fibrosis, that can also occur. The ankle can be fibrosed because of this. They can all get relief if they are willing. Most of these patients will be very obese. That reducing the obesity is the most important thing for the varicose vein, and that is applicable for the varicocele and also for the piles also.
Actually, when you're talking of these medications, because many of these patients will be having some chronic other conditions, it is said that many hormones that are done for used for hormone therapy or steroid medications or diuretics or calcium blockers and some antidepressants and all of these things normally are used chronically by patients. But at the same time, they say that these actually affect the blood vessel walls and aggravate the situation with respect to this varicose vein and all those things. So when patients have to take such medications, uh, how or what should they understand?
Simply speaking, they should understand that you are taking all these medicines because you are not able to, you don't know how to correct your lifestyle. All these problems are big. If you're looking at the WHO or this national health, everywhere it's all classified as a lifestyle disease. And I'm telling from my own experience, if you are able to correct, if I'm actually giving clinically supported lifestyle correction, the patient who is following this correctly, they can come out of almost all these medicines within a month itself. There are only few exceptions. If you have put a pacemaker or then you had to take your blood thinner lifelong, because you are already put, it cannot be taken out. This pacemaker for that, because pacemaker is not just applying on the chest, it is actually applied and the leads are going into the heart. It cannot be taken out once it is put. So you had to take the blood thinner lifelong. Or if you have put a stent and then you have to take the blood thinner, at least the stent is covered for 6 months to 1 year. You should take it very correctly. Otherwise, a clot can form at that point. But after a year, anyway, it will be covered with your own blood cells it will be covering it. So you can safely. Otherwise, the diabetes medicine, hypertension medicine, everything can be withdrawn. Even the patient with renal failure, the hypertensive medicines can be withdrawn. Then only even this creatinine will come down also when if you are removing if you cannot reduce the hypertension medicine without controlling the blood pressure. Only with the control of blood pressure you can slightly gradually reduce this thing. It is all possible, but you should be willing for, and you should get correct guidance also. That is very important.
Regarding this piles, generally it is understood that one of the common conditions that are associated is constipation. So once you have constipation, it is part of developing piles. How are these two matched?
See, if the constipation is there, that means your food habit is not correct. And also if the piles is there, there is something is producing the problem. Your eating habit is not correct, or you may be thinking that you are eating in the proper way. But some food which is making problem for you. So now our advantage is if I'm getting constipation, I don't know what it is the problem. Then generally you take care more leafy vegetables, more fibrous diet, you should take the fruits. That is our answer. And the patient is saying again that I'm taking every day leafy vegetable, and even though it is not going, but that is very, very rare. But usually, in my experience, what I see that for the piles patient, when we take them for the clinically supported lifestyle correction, initially there will be, when they are on, there will not be any problem. They'll be very happy. But after they attend a function and food from outside, it's not a regular sort of food there for a wedding or some other problem and taking a buffet, and after that they will get it. So that we don't know which food, so many food they are taken, and from that which food it is created problem. And then next day they will be having a bleeding. If the patient was having bleeding or there is a prolapse, is the next day itself it will come. So when during the usually ideally what you have to do is, or in the now we have facility to find out, the tests are available to see which is problematic, which is not problematic. But I had seen patients where they are doing the test and all, they know these things are not good for them, but they are going on eating. And then they don't know which all things they had taken the day or the previous day or anything. So there comes, you should be very sensitive and you should simply understand your body and how the food is. Actually, after all, the body is made of food. It is food is made from the soil, and the our body is made from the food. That's the only difference. And either plant food or non-veg food or fish or whatever, it is finally that is what is making your body. If the food is not suitable for you, and the person who is not used to, or the generations, they are not used to take wheat, and they're taking wheat for a long time, they can just simply, it is gluten allergy and all, we know. It is there are so many patients who they can get if you keep away the gluten, they get relief. So there are people I seen the rice, their rice heavily allergic or intolerant to rice. Their IgG or IgE level is very high, and such patients they had to avoid that food also, and then they had to learn how to live with the food which is most suitable for their body. That is the most important.
With this, we come to the end of part 3 of this series on common comorbidities associated with varicose vein, piles, and varicose. In the next part, we will be seeing how lifestyle modulation can make the difference in those who are suffering from these diseases from the experience of Dr. Jolly Thomson. Thank you.